Good afternoon, ladies and gentlemen, FCC members and guests. My name is Joe Pan. I'm the journalist governor of FCC. While you're finishing up your meal, I would like to get a head start with today's program by making some announcements and of course, introducing our distinguished panelists. First, some announcements about the club. Welcome to FCC. We have a lot going on. First, on Wednesday evening, we actually have a luncheon right here. We have diversity in the newsroom, featuring some of the interesting and pioneering works of the newsroom in diversity here in Hong Kong. There's still some opening. If you're interested in it, regardless you're journalists or not, please come join us. And then on the 27th, on Thursday night, we have a quiz night. So do sign up if you're interested in playing some games at the same time, supporting some worthy cause. We also have something going on, another luncheons on May 2nd, Dream Drop Nightmare, Asian professional trafficked by cyber scammers. So you probably read and watched something about it, and now you can actually hear from someone who covered. And of course, we have other online events still continue. Events such as the unspoken cost of truth, mental health in journalism. And we hope you can join us on May 9th for that. Do sign up at fcc@fcchk.org. With that, now it's my honor to introduce our distinguished panelists, authors of the book, How COVID-19 Took Over the World, Lessons for the Future. It feels unreal in some way that less than 4 months ago, COVID restriction was still in force. Gathering like this today would have been very difficult, if not impossible. If anyone who's qualified to share a retrospective, offer lessons for the future would be our panelists we have today. First, the editor and author of the book, FCC member Christine Law, who's joining us via Zoom because she has recently contracted COVID. So she would talk more about it. And it's a very, Christine Law is the Chief Development Strategist at the Institute of Environment at Hong Kong University of Science and Technology. She's also a visiting scholar at Anderson School of Management, UCLA. She's also known to many of us as the former Undersecretary of Environment and the former LegCo member of the HK Special Administration and the Hong Kong government. She has edited and co-authored many academic and popular publications, including at the Epicenter, Hong Kong, at the SARS outbreak. That's back in 2004, for those who remember. Apart from her university-related work, she serves on the board of several listed and non-listed organizations in Hong Kong and overseas. She's a lawyer by training and a commodities trader by profession. And joining us in person, of course, are the two authors and contributor to the book. Professor Ben Colling is Chair Professor of Epidemiology and co-director of WHO Collaborating Center for the Infectious Disease Epidemiology and Control at HK's Hughes School of Public Health. His study and in this area has been recognized globally and supported by policy decisions around the world. He has been listed as one of the most cited scientists in the world since 2014. In 2021, he was appointed by as MBE by Her Majesty Queen Elizabeth II for service to the public health and COVID-19 research. Dr. Judy McKay, OBE-SBS, is a British medical doctor who has worked in Hong Kong since 1967, initially as a hospital physician, then since 1984 on tobacco control. She is director of Asian Consultancy on Tobacco Control and senior policy advisors to World Health Organization. She has received many international awards ranging from WHO Commemorative Medal to the Times 100 Award. She has been identified by the tobacco industry as one of the most dangerous people in the world. Wow, what a credential, huh? Her interest in COVID lies in WHO response, the world, and the way the world has been unhealthily industry, like the tobacco exploiting the pandemic. She suffers from long COVID, so she would share a little bit more about that. Well, with COVID pandemic as the most acute mortality shock since World War II, with 6.5 million confirmed deaths by the end of September 2022, but an estimate of another 18 million by other accounts, adding competing theories on the origin of the virus, and various measures fail or successfully in the containment of the virus across the world, including Hong Kong, our very own districts and homes and blocks that we live in, as one of the strictest enforcements in the world. There's so much to unpack here within the next hour. I would like to ask each panelist to start with opening statements, and we will dive into different sections and chapters of the book. Then we will open the floor for questions. Hopefully we'll have enough time for everyone. So first, Professor Law, please, how are you feeling today?
Hi, well, I'm so sorry I can't be there. And after 3 years, this is the first time I've contracted COVID, so I'm rather upset with myself. Anyway, maybe as the editor and co-author of the book, I should start by just sharing with you how the book came about. Hopefully you will have a chance to acquire one of the books later on. So this is also a little bit of an introduction into what else is in the book. Of course, we have two of the authors there, but the book has been contributed by quite a number of other people as well. So first of all, I mean, as Joe, as you mentioned, in 2004, I was editor and co-author of the book from Hong Kong U Press on SARS. And I was asked to work on the book with SARS because at the time, well, you all remember what Hong Kong was like. And there were lots of people from different walks of life trying to understand SARS and how to kind of get over it. And we didn't know at the time that it was going to be a short and sharp affair. Like we didn't know this time that this was going to be a very long and difficult affair. So when I was asked in the middle of 2020, right, to put a book together about COVID, we really didn't know how long it would last. My second thought at the time about whether I could put a book together was, well, what would we write about? And you will remember back in mid-2020, there were lots of articles. I mean, the news was full of all kinds of things about COVID. I started to think at the time, two key questions, right? What might we address? And secondly, is you need to put together a writing team. And I started with thinking about who would be the sort of people that I would like to work with. Well, actually, one of the first names that came up was Judith. Judith and I have had a long kind of friendship, and we'd worked on anti-tobacco things when I was in LegCo. But the thing about putting a group of authors together is they've got to be knowledgeable, and they've got to be able to write well, and they've got to be able to deliver on time. This is the work of the editor. So I'm proud to say that I work with a really, truly excellent group of authors who really everyone delivered their work on time. In fact, some of them delivered it early, which is, of course, a total delight if you are the co-author. The other thing about this writing group is that they were willing to read each other's chapters. Because whilst they all come from quite diverse backgrounds, people were interested in what others had to say. So each one had read a few of the other chapters. So it was extremely helpful. Now, in terms of putting people together, I thought, well, it'll be extremely helpful if we could perhaps try to cover subjects that are important, but less well covered. Now, we had already gone from mid-2020 now to mid-2021. No one had started writing yet because it really still wasn't quite clear where COVID was going. But we did start to think about putting our writing together in the latter half of 2021. And the publisher was keen for us to finish the book or the manuscript by the spring of 2022, which on the whole, we met that deadline. But of course, things blew up again in 2022 with more waves of COVID, including the one in Hong Kong. So in fact, for several of the chapters, people had to continue to write and change and adapt pretty much till the end of 2022, because the book essentially was finished at the end of 2022 and it came out in February of 2023. So that's the sort of writing side of it. Now, this group, we met several times over lunch to discuss what we would focus on, how we would approach the chapters. And we use kind of three concepts to guide us generally. One is about governance, because COVID is a big thing. It happened to all of us. Governments had to act. So governments from around the world, as you've all probably noticed, reacted in different ways, different pace, and made different choices. So we used governance as a central focus. And in talking about governance, we also use the concept of the social contract. How did people look at the role of government? What was the role of government? What were they supposed to do? And then we looked at trust, because this obviously had an impact in how people looked at information from government, what government wanted them to do. And then, of course, this culture was also a major issue. So once we have the writing team, and we had a focus on how we would approach our chapter, I think everybody got very busy and started to write. So if I can just end this early part of my introduction by saying that you could broadly say the book is divided into two big parts. The first part, the first 8 chapters, are to do with some general issues. So for example, Ben, his expertise is in vaccines, and he contributed a very elegant chapter on vaccines. Judith, only she could have written the 2 chapters that I think she contributed. One is about the WHO. Of course, the WHO was all over the news all the time, but what was its role? And what is the role of the wider United Nations, of which the WHO is a key agency? So Judith, with her background, is just ideal to write that chapter. And I haven't actually seen in other literature a fulsome description of the role of the United Nations and the WHO. And then I'll wait for Judith to talk about her other chapter, which is about what I call the big bads, certain industries that took advantage of COVID to promote themselves, including on tobacco. We wanted a chapter on the global economy because that's also a major issue. The amount of money government has had to spend, the amount of earnings that people lost, and particularly the difficulty for lower income families all around the world. I was lucky to co-write this chapter with Professor Michael Edison, who is an economist and a mathematician, and he also contributed a very interesting chapter about the mathematics of understanding SARS, which was particularly important in the early days as to how it spreads. There's a very elegant, relatively short chapter in the book by Renu Singh, who at the time was a professor in public policy at HKUST, but she's now a professor in Italy. She is a public policy scholar, and her chapter focused on explaining the notion of the social contract. Then, PPE was a big question as well. You'll remember, particularly at the early stage in 2020, there was a shortage of PPE, and people discussed a lot about supply chains. And you could say that this whole notion about reshoring of critical supply chains like PPE, remains a major issue. And I was lucky to have Professor Christopher Tang from the University of California at Los Angeles, a colleague of mine at UCLA, and he is a supply chain expert, and he wrote a chapter about supply chain, which So these, in a way, are the chapters that I think have not been so widely discussed when people talk about the experience of COVID. The second part of the book, it's really more geographical. Now, of course, we're in Hong Kong, we're in Asia, we're in Greater China. So there are 3 chapters that relates to mainland China, Greater China, and Hong Kong. So those 3 chapters could be read as a package. And one of those chapters is written by me, and actually is a contrast between the reaction from mainland China and the United States. And then we have another chapter from Renu Singh, who is an expert actually on Europe, and she contributed a chapter on the EU and the UK. So you could say the geographical chapters cover Asia, Greater China, contrasting Europe and the US. So let me leave it there for now.
Thank you. Definitely do look at the book, and it's not a thick one, but it's actually quite easy reading, and it's one of the most footnoted and researched with a long list of 5 pages of further readings. And so it feels very academic at the same time. It's a very good read for the general public. So now I would like to turn to Professor Colling and ask you to, given the Professor Law's case of contractions of this late stage, I would love to get your view, in addition to the introduction and your role in this book and contribution made to the book.
Yeah.
Is the eradication of COVID viruses achievable in the short term, or this is more of a containment and mitigation on
Well, so we've had COVID circulating around the world now for more than 3 years. I don't think there's any sign the virus is going to disappear from the world. It's going to continue to circulate. But hopefully, as time goes on, infections will become milder and milder on average. And in fact, one of the common cold coronaviruses that we may have had in the past originated in a coronavirus pandemic in the end of the 19th century. So we know it's only been in humans for a little bit over 100 years. And I suspect COVID will take the same course, that in 10 or 20 years, it will be typically a very mild common cold infection. But that's not to say it will always be mild. And actually, every year in Hong Kong, people end up in hospital with common colds, not just the flu, but other common cold viruses as well. In terms of the current wave, it's interesting that COVID seems to come and go in waves. So in Hong Kong, we had a wave in March last year, peaking in March last year. We had another wave in the summer last year, another wave at the end of the year, and now we're in another wave now with numbers going up again. And I think in mainland China, they're also having a resurgence in cases just 4 months after their enormous wave over Christmas and the New Year. So it's interesting. One of my areas of research is to try and figure out how long immunity lasts for. Why do we keep getting reinfected again and again with these viruses? Is it because our immune system is losing some of its protection in some sense over time? We know immunity does decay. Or is it the virus is changing fast, and so it's able to have a new version which gets around our defenses? So that's an interesting area for research. Unfortunately, in Hong Kong, we're also having a flu season for the first time in 3 years. So before the COVID pandemic, we had flu every year, possibly more than once per year, a winter season and sometimes a spring season or a summer season. And every year, a lot of people end up in hospital. We've estimated that before the COVID pandemic, it was between 5,000 and 10,000 people get hospitalized every year in Hong Kong with flu. So far, the number of the current epidemic is not that high, actually. So there's still a way to go. And because we haven't had flu for the last 3 years in Hong Kong, there's probably greater susceptibility in general. So people may be more likely to get it than they would ordinarily be. And if they do get flu, it might be a little bit more serious than it would ordinarily be. But not an enormous amount of difference, but there is a risk that the current flu season could be bigger than an average one. And if not now, then in the coming winter, that there's a risk that would be bigger. But these are just things that happen every year. Before the COVID pandemic, we would get multiple respiratory infections every year, and we wouldn't think so much about it. But now with COVID, we're all on high alert. Every time we get even a sore throat or a sniffle, we do a rapid test immediately. And in one of my projects, we have a 4-way rapid test now: flu A, flu B, COVID, and RSV as well. So it's in the future, I think we'll have even more of these opportunities to diagnose ourselves and figure out what we've got, and then maybe stay at home, because we understand now staying at home is a really good thing to do, wearing masks and so on. We've learned things from the COVID pandemic that we can continue to apply in our own lives.
Great. Well, we'll come back to the measure different staying home or different wearing masks or social distance a little bit more, I'm sure, from the audience as well. Now let's turn to Professor Mackay. And so please share with us. And I introduce you that actually noted you have long COVID. So it's coming here today and others. So what's it like living with long COVID on a daily basis?
Well, getting up the steps from Central is quite an effort. Just as Christine has COVID, I've got long COVID. So we're actually living our book as we speak. I had 4 vaccinations, the mRNA ones, and then caught COVID very shortly after the 4th one in Edinburgh last year, and was quite poorly. I was positive for about 12 days. And it's left me with fatigue, and it's left me with breathlessness, and quite a few other bits and pieces as well. But essentially fatigue and breathlessness, and particularly breathlessness on exertion. I find there's very little understanding and recognition of long COVID in Hong Kong at the moment. And I've had to really struggle to find the places to go and the services that are on offer. There's no one-stop COVID clinic, long COVID clinics that you can go to and get some kind of sort of coordinated health plan. Luckily, I say, I actually had a lung scan done, because when I used to say to people, you know, I have fatigue, I have some breathlessness, the common response would be, well, you look very well. And then secondly, it was, well, you know, I feel tired at the end of the day as well. And the lung scan actually changed it, because my lung scan showed, and still shows, that I've had bits of my lung that are collapsed. They are scarred. I've got little immune nodules all over them and lymph nodes up in my lungs. And my husband said to me, do you feel better or worse having had this lung scan? And I said, I feel actually better, because it validates what I've been saying for the last several months, when people almost, not exactly dismissive of what I was saying, but the fact that I do look okay didn't really indicate how poorly I was feeling. And there's still no clear future for me. I might start feeling better tomorrow. I might have this the whole of my life. Nobody really knows. So my feeling is that this is not a benign virus. We're not over even the acute phase of it yet. And we have a long way to go before we're going to be over the chronic phase. The estimates of how many people get long COVID are quite variable. And of course, there's vast parts of the world where no research is done on this, like Africa. We just don't know the numbers from there. There are some countries that have done some kind of studies on it that show anything up to 50% or more of people have symptoms after 3 months, which is the definition time. So as I said, Christine and I are living examples of the book that we've just written. There are over 200 symptoms, so it is quite difficult to evaluate, and whether studies have done on people who've been hospitalized or not, the cutoff dates, 12 months, 24 months, but there are certainly more people than you think in life who have got long COVID. And I think this really deserves recognition. This is why I do speak about it when I'm actually speaking professionally about other things else. Sweden, for example, half of all the patients who are on sick leave at 4 months with infection were still on sick leave at 24 months. So it doesn't end soon. It's quite a long time. I was asked by Christine to write on on WHO, because I'm a consultant with WHO on tobacco. So I thought, well, I know WHO through and through, this will be easy. Well, it wasn't. It wasn't my specialty. So I had to do a great deal of work to look into the infectious disease side of WHO, which I hadn't really done before. And the chapter started out at looking at WHO, but I was absolutely astonished to find that virtually every United Nations agency, and I think there's about 36 of them, every UN agency played quite critical roles, especially the United Nations Development Programme, the UNDP, the World Bank. In fact, every UN agency, except those involved with weather and warfare, those were the 2 exceptions. They had not got a program on COVID. Every other single agency in the United Nations was doing something, and something quite important. For example, the World Trade Organization was dealing with IP rights regarding the COVID vaccines. And with the IMF, they were publishing the vaccine trade tracker. The International Atomic Energy Agency was involved with biosafety supplies and the safe handling and analysis of COVID samples. But WHO was, of course, the core agency, and it came in for praise and criticism, which we can explore in more details later. Did it act quickly enough? Did it have enough enforcement power? Did it even have funds to tackle the epidemic? What lessons have we learned for the next inevitable epidemic? I would just at this point say that there's a lot of misunderstanding about WHO and its authority. And WHO itself is basically a secretariat of member states. And I'll just take Taiwan as an example. Taiwan is not allowed to attend the WHO meetings, and many people are very critical of WHO for that. Actually, it's nothing to do with WHO. It's the member states, the almost 200 member states who vote on the issues. They vote on policy, they make the policy, and WHO is in fact the secretariat that enforces it. So the fact that Taiwan is excluded from WHO and most of the UN agencies is not a decision of WHO at all. It's a decision of all the member states who make that policy, just to clarify that. And this was certainly true throughout the epidemic as well. So I'll end just now on 4 bullet points for WHO. Firstly, just to remember, it was a response of the whole United Nations. Secondly, I do believe that WHO could hardly have moved more quickly from the day it was informed. On the 31st of December in 2019, WHO in Geneva was notified by their office in Beijing that there was some problem in Wuhan. The following day, WHO issued an IMST, which in fact put the organization on an emergency footing for dealing with the outbreak. On the 2nd of January, a day later, it informed the Global Outbreak Alert and Response Network, major public health agencies, NGOs, all governments, and so forth. And it's really hard to see how it could actually have acted much more quickly than what it did at the very beginning. The third point I would make is that there's no organization in the world other than WHO that is capable of tackling an epidemic at this global level. WHO has been in existence since the 1940s. It has the membership and to a very large extent the trust of national governments in a way that non-governmental organizations do not. It has the trust of national governments. And I would just add, I'll just finish on this bit of WHO by saying that they are at this moment negotiating a pandemic treaty. Now, WHO only has one treaty, and that's the Framework Convention on Tobacco Control. That's the one I've been so involved with. But they're thinking now of having a second treaty, which is a pandemic treaty. And this moves it forward from general advice to an agreement between nations. This is what we will do. It's mired in controversy. It's being many aspects of it are being obstructed by some of the member states who don't want supranational jurisdiction over it, the US in particular. But anyhow, the pandemic treaty is being negotiated as we speak. And then finally, I suggested to Christine, we have a chapter on what she calls the big bads. I call them commercial determinants of health. And much has been written about government action during the pandemic, but remarkably little on what big business did. One of the 2 reviewers of this chapter was so surprised to find a chapter on commercial determinants of health in a COVID book. However, wrote, I found this chapter eye-opening. They'd never really considered it before. These commercial determinants of health are not new. Sectors of the public health community have been battling them for decades, myself included. And big tobacco was the first industry in modern history to be recognized so clearly as interfering with public health policy. But it wasn't just tobacco, I discovered. Big alcohol, big ultra-processed food and drinks, big breast milk substitutes, big fossil fuels, big gambling even. They all immediately devised remarkably similar strategies to capitalize on the COVID endemic. I used tobacco in the book as the main example because it is the best documented. And the interference involves, for example, the infiltration of several United Nations organizations. It occurs at national level, and it included attempts to interfere with governments, politicians, and the media. The tobacco industry strategies have included tobacco advertising, promotion and sponsorship, discrediting the proven science and economic data, maneuvering to oppose a political and legislative process, exaggerating the economic importance of the industry, manipulating public opinion to gain the appearance of respectability, fabricating support through front groups, and intimidating governments with litigation or the threat of litigation or trade threats. And if you think those are rather strong words, these are words from WHO itself, and WHO is a pretty conservative body. So for them to actually come out with this kind of terminology is extraordinary. So in conclusion, the bullet points about this is that historically, yes, we've had asbestos, we've had lead, we've had quite a lot of attempted manipulation of national policy, but modern epidemics are involving commercial enterprises. Tobacco is the best research. In practice, there were many industries who behaved really badly in this epidemic. But I actually believe that these modern epidemics, the non-communicable disease epidemics, will never be halted unless these commercial determinants are recognized and governments take action. And one example is the Philippines. The Philippine government, through the Department of Health and the Civil Service Commission, have got a joint memorandum whereby any interaction with government by these industries, particularly at policy level, has got to be transparent, and it prohibits government from having unnecessary interactions with the tobacco industry. And Christine and I were asked to speak at the book festival about a month ago, and the person who was sort of comparing us then was Richard Fielding from Hong Kong University, and he also added into that corporate plunder. And corporate plunder was things such as Ben referred to PPEs and things like that. I think that's a story that is still to be told, how appointments were made, for example, in Britain about supplying PPE at an exorbitant cost and with friends of government and things like that. So that is a very, as Christine says, I think a very unusual chapter in this book, because most books on COVID really don't deal with this at all. So thank you.
Thank you. Professor Colling, if I can go back to you, maybe talk a little bit about your chapter and also the failure to account for the exact death toll of the pandemic, a lot of attributes, including the poor record keeping, and the fail of actually having the proper test. But from the scientific point of view, can you share a little bit more? Is there a very definitive way of defining the methodology and the criteria and the accountability and what we have learned and what can we go share as a lesson for the future?
Sure. So, well, firstly, for my chapter in the book is a chapter about vaccines, about how vaccines came about, the investment in vaccines from different parts of the world, and the enormous number of lives that were saved because of vaccines being available just a year after the start of the pandemic, which was a remarkable scientific achievement, actually. And it's good news for preparedness for future pandemics, because now we know what we can hope for. I would say at the start of the COVID pandemic, it wasn't clear to most scientists how long it might take and whether we'd have to hold out with public health measures for a long time. And I know some governments didn't see the value in waiting for a year or 2 years for vaccines to become available. So yeah, the chapter in the book is about vaccines. In terms of the number of deaths globally, I think the number of laboratory confirmed deaths is something that we can count because that's reported by governments around the world. But we have to be a little bit careful with that number because we know the criteria to be counted in that number is just a person typically has to have tested positive within a month of their date of death. And if they were hit by a bus, but they tested positive for COVID in the days preceding, then it will be counted as a COVID death. It makes more sense to actually think about what would have happened if there wasn't a pandemic. And we know every year that there's a certain number of deaths globally. And then we think about how many deaths did occur around the world and think about the impact in that way. And so that there's established methodologies for doing that. But one of the other complications is that the world changed in the pandemic. And so referring to the numbers of people that died before, in the years before the pandemic, is in some sense not a fair baseline because, for example, there wasn't any flu in many parts of the world. And that kills a number of people every year. It's probably 1 or 2% of global deaths every year. And with people staying at home more often, there's declines in other kinds of things. And then because hospitals were focusing on COVID, I know for a fact that many appointments for cancer screening were missed, surgeries for cancer were missed. And so there's an increase in the mortality from cancers, may even be continuing now and in the coming years, unfortunately. And to some extent that is attributable to the pandemic, but those deaths are not COVID deaths. So I think it's a thorny issue to try and count the impact of the pandemic with just a number of deaths. I think there's so many different metrics. There's the people whose lives have been disrupted, the economic costs as well, the societal costs, the loss of education for children. It has an enormous impact. And I think we'd very much prefer that in the future when pandemics do occur, because they will occur again, we can reduce that impact as much as possible in all the different aspects. So not only the health impact, but also all the other secondary impacts that we're aware of now.
Thank you. Now I would like to invite the floor for any questions, and so we can go right to it, dive into all the specifics, and hopefully Professor Law will be able to speak for those who are not here in present, as if you can share a little bit about the economic impact, and you and I chat about the use of the community and community policing system, or the way that the gated community is set up in China, and how it can apply for the future, or the lesson learned and application in various ways to defend the public health. So maybe you can also mention about that as well. So at this point, any questions? Let's start with the gentleman in the back.
This
Please,
question
I'm
is,
sorry, please identify yourself and if any association.
yeah, Tony Watson, Far East Investment Management. This one's for Dr. Cowling. To what extent are you concerned, and should we be concerned, that the Hong Kong government is not going to conduct a public inquiry into this pandemic and the response to it, as they did with SARS? Just as
well, that's right. So after the SARS epidemic in Hong Kong, there was an inquiry led by international experts, and I think that produced some very valuable findings, which actually contributed to Hong Kong's response to the COVID pandemic 20 years later. A lot of the recommendations from that report were taken on board. The Hong Kong government created the Center for Health Protection, which we didn't have before SARS, and invested in hospitals and lab testing and so on. So I think it would be valuable for the Hong Kong government to establish an independent inquiry. Most countries in Europe, I think, are doing that. Around the world, I expect they would do it at some point. And I think we could learn a lot about what was done well, what could be done better the next time, and also learn from international experiences. So let's see, but I hope that's something that will be done.
Yeah, I actually think it will happen. I think the question is when, and you get rather different results. I mean, we wrote a book very early in this epidemic, and we amassed every bit of information that we could. But as Christine says, things changed dramatically in China. There was the emergence of long COVID that was really hardly there at the beginning. So I think it depends at what stage you do it. And I actually myself feel we would probably do better waiting. Ben may disagree, but I think we'd be better waiting just a year or two so that we can look back slightly divorced from being in the middle of it, as we still are, and learn greater lessons from that with the perspective of time. I think the government, I'm pretty sure the government will do it. And I would just say about governments, you know, COVID presented us with a situation of having to try and fly a plane when we were building it. I mean, nobody knew what to do. There's not been a single government in the world that hasn't come under criticism from its citizens about whether it's done the right thing or not. And I think we need to have a bit of understanding how really difficult it was for governments being faced by a completely new epidemic. We still don't know half of it to this day, and this was now 4 years ago. We knew some of the ways to respond, but certainly not all. And I personally think the Hong Kong government didn't do a bad job. It protected us for a couple of years. It shut down, it had all sorts of economic effects, but compared with many governments in the world, I think it actually, you know, I think it wasn't bad the way that the government here responded to the epidemic, is my feeling. It was cautious. That's probably no bad thing. But actually, if you look at these sort of numbers around the world, for example, of people who died from COVID, they're remarkably consistent, whether like in Sweden, they didn't do any lockdowns versus countries like Italy that did. We're learning as we go. And I think that is an aspect we have to take into consideration when we're criticizing governments. Not that you were, but you're asking a question.
Professor Law, would you like to comment on that?
I think it's fair to say that COVID is truly confounding. And as both Ben and Judith have said, we aren't quite finished with it yet. There are so many manifestations of this particular virus. We don't know everything about it yet. So if we go back to SARS, and I make this point in the conclusion of the book, because I remember so clearly that the WHO actually made it very clear at that time that when you have an epidemic bursting out somewhere, you haven't got to be just 100% prepared. You have to be 300% prepared. And what does that mean? That means that when you see the head of a potential infectious disease, rising, you have to clamp down on it fast and furious. Now, of course, when you do that, governments won't actually know whether, this is going to be a mild case or whether this is going to be a severe case. So this notion, this advice that you come down on it like a ton of bricks is going to be risky for politicians, because if it turns out to be a, mild thing and it's over within a short time, you're going to be criticized for damaging the economy and overreacting. But when it blows up like COVID-19, then again, you are going to be criticized for not doing enough. So as I said, I'm not making any excuses for anyone. I'm just saying COVID was truly confounding. Secondly is we did see a whole variety of response from different governments, different political systems, different parts of the world. And on the whole, in the earlier phases, those jurisdictions that acted fast basically did well. And it didn't matter where, what kind of political system you have. And it ended up that on the whole, those in the Asia Pacific were more careful. There was more cavalier in North America and in Europe, and people were more careful in the Asia Pacific. But maybe that was because we understood SARS. So then, because we had waves after wave, even people who did well at the beginning, like Hong Kong, actually like Taiwan, like Australia, these were all places that subsequently were hit again, right? So I think it's fair to say that nobody got it completely right over 3 years. We had a variety of responses, and we see people who did well earlier on lost it, and we see people who didn't do very well earlier on really didn't manage to do well later on as well. And it had nothing to do with how rich the society was. Didn't mean that just because you were a developed economy that you necessarily did better. So that's why the book, in terms of looking through their reaction through social contracts, culture, governance, and trust, was an interesting lens as one to help us to understand the reactions of humans.
Thank you. In terms of questions on the order, I see here in the back, and then I thought I saw a hand right here, and then we'll go to the gentleman in front.
Nick Thompson, no affiliation. What lessons have we actually learned?
That's a really difficult question. For Hong Kong specifically, I think I would say, I don't know if others would agree, I would say we've learned not to think that we can stand on the seashore and turn back the tide. So in 2021, I gave numerous interviews saying that we can't keep COVID out forever, and zero COVID is a strategy that's somehow doomed to fail sooner or later. And we've got to acknowledge that and make sure that older adults get vaccinated. And unfortunately, by the end of 2021, only 25% of our over 80s in our community had been vaccinated, only 25%. And I think that was, to me, the biggest mistake and the lesson that we have to learn for a future pandemic, that we can do very well. At the beginning, we can have excellent contact tracing, excellent quarantine. We can buy a lot of time, much more than other countries can buy, other parts of the world can buy.
Yes.
But we can't hold it back forever.
Thank you. That's very, very interesting. Basically, we don't know how to carry on. I mean, we sat out COVID in Penang. We just happened to have left Hong Kong a few weeks before. And I was over 70. I was diabetic, but I actually didn't get called up for a vaccine until I'd already been to the States because they were so late in handing out the vaccines. I went into America. Any pharmacy I could go to, they were only too happy to have me there. All I had to do was to show ID and fill in a small form. And I was very impressed with that. You know, somebody mentioned that they were cavalier in their approach. I was very impressed.
Yeah.
But I have to say that I'm not quite so optimistic about lessons that we've learned. I mean, if you look throughout history at all of the epidemics, I mean, to the Black Death and all of those sorts of things, we just are not very well prepared for them. And at SARS, Christine will say that we ended up with SARS saying we must learn lessons from this, we must be more prepared. There was in Hong Kong some attempt at that, but I mean, around the world is not prepared for pandemics that sweep the world. And in fact, interestingly enough, historically, the ancient people knew that about every 30 years, there was a wave of some kind of pandemic that swept around. And they thought it was under the influence of the stars. They, of course, knew nothing about viruses. That's how influenza got its name, the influence of the stars, because it sort of swept across the world. And I think we've got to try much harder in pandemic preparedness to actually be ready for the next one, because memories fade, even after 20 years only, memories fade about basically what to do. And that's why, in a sense, the treaty might be quite important, the treaty that's being negotiated, because it will formalize it within WHO and governments, what needs to be done and when, and the readiness to sort of take action. A pandemic treaty, I think, will pull that together. With tobacco, it has certainly pulled together countries in terms of knowing what to do regarding taxation and legislation and cessation. It's sort of come together with a very central focus. So having a United Nations treaty, I think, might be quite helpful. But the other point, of course, to make about viruses, they don't come and go at all. You've only got to look at polio. You get polio at 15, then when you're 60, you start getting funny neurological things. You get hepatitis B, and then 30 years later, you get liver cancer. You have a chickenpox virus, another 70 years on, and you get herpes zoster on the face. These viruses linger on with us. Bacteria tend to come and go, but these viruses are serious in terms of their incredible longevity and how long they stay with us. So I think we need much more attention to virus illnesses around the world.
Just to be mindful of time, gentleman in the back, and then there's a question right there, and then right here.
Yeah, this is Dr. Jain. I'm a practicing dentist. And I was here during SARS time, and I'm sure all three of you were there. What surprised me was the response that we had to SARS and the response we had to COVID in Hong Kong. In SARS time, we just decided after 6 months, it's over. We partied, we called people from all over the world. Everything was open, I believe, from memory. And then with this one, we had such a prolonged stay. We stopped testing people for SARS. I'm sure if we did, we would have still found a lot of numbers. So it was a very markedly different response. Why do you think it was that? Was it nature of the virus, or why didn't we learn those lessons? And everything became normal after SARS very quickly in Hong Kong.
So SARS was a very different virus in 2003. It was about as contagious as COVID, but it spread mostly in hospitals, mostly quite late in someone's disease. Whereas with COVID, it spreads mostly in the community and people are contagious quite quickly. So it's much more difficult to stop COVID than SARS. So actually in Hong Kong, SARS was over within 3 months. Really, it was a very short epidemic and it was contained. If the Hong Kong government had done nothing about SARS, it would have kept spreading and it would have caused an enormous amount of trouble actually. But the government really got to grips with it, figured out the way it was spreading and the way to stop it from spreading, and did a very good job very quickly. So Hong Kong was badly affected, but that was somewhat bad luck, I would say. Badly affected, but it got on top of the infection, controlled it. And fortunately, at that time, the virus was having a nature that made it more controllable. If we'd faced COVID 20 years ago, it would have been a global disaster, absolutely. Now we're much better prepared. We've had vaccines, as you know, after a year. We had testing. Nothing like that would have been available 20 years ago. It would have been devastating for the world. So at the time that SARS emerged, we knew there was a risk of coronaviruses jumping from animals into humans. The reason that I came to Hong Kong in 2004 was to prepare for SARS-2, because we knew it could happen again. But thankfully, it was 20 years until it happened again. We have to be on the alert that it could happen again at some point. We don't know when, because there's an awful lot of coronaviruses in bats, in Asia and around the world. And who knows when the next one will emerge that's able to infect humans and then cause yet another coronavirus pandemic. So that's really, for 2008, I think we were somewhat lucky with the virus. And in Hong Kong, we were able to deal with it very effectively, actually.
Yeah, I think SARS was the exception rather than the rule. To contain an epidemic so quickly was extraordinary, actually. And we were just, as Ben says, we were just very lucky. But I think with SARS, it wasn't until you really got bad symptoms that you became infectious. So people knew people were ill. The coronavirus that's caused COVID-19 is more like flu. You're very infectious the day before and the day after. That's a peak of maximum infectiveness. So many people in these rooms might find tomorrow they've got COVID and they might be infecting people as we sit. No, I don't wish that upon anybody. I take that back. It's a hypothetical situation, but you can be infectious without symptoms with COVID, and that's the problem. Whereas that wasn't true with SARS.
Yeah.
Gentleman, lady.
Jessica.
Hello, Jessica Park, representing me. You mentioned Taiwan earlier, and it's not a party to some of these meetings, and because it's decided collectively by the United Nations, we all know why.
By the member states, by the member states.
By the member states. Yes. And you could say, therefore, that United Nations is political and WHO is political. And all three speakers have worked for WHO at one stage or the other. So one worries about the politicalization of WHO. When, Judith, you talked about the treaty that WHO is trying to currently work on, that's also caused great concern globally. Because if you've got one party of scientists trying to work out a treaty that's best for all of us, you've got another party that's obviously going to disagree with that. And when we talk about viruses, we keep talking about, well, there's one animal mixed up with another animal. But then we had the Americans who are funding the lab in Wuhan to develop beyond animal to animals. And we all know about warfare and biological warfare. And did we go too far? We don't know. If we're mixing warfare with these different viruses, we're in a lot of trouble. Is anyone asking the question about what are we doing to try to control that sort of thing, if indeed that was the cause? Because if we're not, we're missing the target totally. And if we're not open about the origins of this, we're missing the target totally. And we're in a mess unless we start talking about the real origins. What is the role in regards to governments about warfare? There are lots of things in the world which we banned in regards to warfare. When on earth are we going to start banning biological warfare? Another one about, Ben, you talked about 80-20 and the old people, and it's very bad that they didn't get vaccinated. And then we talk about, well, you have to get vaccinated because I say so. And then there's the first time I'm not saying that you said that, Ben, but I'm just saying governments around the world are forcing people to get vaccinated. For the first time in global history, we're being told that we must take these viruses of not 100% proven value to be put into our bodies. And that's another worrisome situation. I'm not sure whether they're statements or questions, but that's what I have for now. Thank you.
What to do the vaccine?
Well, so in terms of vaccine mandates, I'm really thinking a lot about the pros and cons of mandates. And if we think back to 2021 in Hong Kong, if more pressure had been put on older adults to get vaccinated, maybe it would have boosted the rate, but there could have been other ways to get the vaccination rate to a higher level. And for younger people in Hong Kong, although vaccination is beneficial, I'm still not convinced there was sufficient grounds to mandate it essentially for 18-year-olds. I mean, I'm certainly not against vaccination of 18-year-olds, but I'm not sure there was sufficient grounds to essentially mandate it. And I know the government changed the law for employers to say that they could fire unvaccinated employers. At my university, people were banned from going to campus if they hadn't had 3 doses. And so I think we have to think carefully about what to do the next time around. I wouldn't say it's unique, because in some parts of the world, they do have requirements for childhood vaccines. If children want to go to school, they have to have their childhood vaccines. And I agree with that. I mean, that makes a lot of sense. Measles is a really, really nasty disease. We do not want it to come back. But having said that, I think in many places, although on the books there's vaccination requirements, I'm not sure it's very strictly managed. It's there, but it's not the kind of thing that's enforced in the way that COVID vaccine mandates were quite strictly enforced. So that's what I would say about the vaccine mandates. I don't know if you have any other.
No, I would talk about, you're questioning, Jessica, the sort of the origin of it and trying to find out where it started. And I think the jury's still out on that, to tell the truth. We have to remember, even with AIDS, which emerged, in the 70s, and again, looking for the origin of how AIDS started, probably in Africa. I remember it being reported by the Norwegian Health Department that there had been a Norwegian seaman who'd gone to Africa in 1954, had gone back to Norway, died, his wife died, his 2 children died, and they kept the blood samples and they were positive for AIDS. So these viruses are sometimes incredibly difficult to track down where these first originated and where they jump species and things like that. I think with the present epidemic, the jury is still out on that, but people are still looking, because as you very rightly say, if we don't understand where they're coming from and what the hosts are, we are less prepared for the next one that comes. So it makes it, I mean, that's what makes it important, finding out the origin, but people are tracking it down. But health is political. Health is political, there's no doubt about that at all. And so what we've got to do is to work best with the politics we have to get the best outcome. That's public health.
Thank you. So let's just get down.
Okay, thank you. I'm Mark Michelson, IMA Asia. Thank you for all this. You've demonstrated it's complicated, as we all know, and it can be very confusing. I'm going to try 2 more C's: communication and cooperation. Communication, I think, was a real difficulty during the pandemic. Not because, of course, it was confusing and it wasn't clear, but we didn't have one, in Hong Kong included. We didn't really have one voice or 2 voices. We had a lot of voices, which could be very confusing, contradictory. In contrast, during SARS, and I know it was a short term and so on, but it was seemed to be much better organized. Secretary of Health generally spoke every day and sort of told us the good news and the bad news. This time, other places, I think, did a little bit better than us. Singapore, in particular, I don't know what it's like to praise Singapore, but the Prime Minister was on regularly with the good news and bad news, and there was a person in his cabinet appointed, really 1 or 2, that would be the spokespeople who would take advice from doctors and so on. Can that be improved? That's important. And the other is cooperation, especially in vaccines, where we've had developments of vaccines, but we've also seen problems in cooperating in an area, despite the geopolitics, that's often thought as one of the areas in which we should all be cooperating with China, the US, Europe, and so on. It's vital. Did you talk about that or see any signs of hope going forward that we've learned some lessons from the pandemic in those areas?
So, it's a real shame with the vaccines. It's a real shame that what ended up happening is a lot of the richest countries hoarded vaccines. Essentially, they ordered more than they needed, and then they didn't use them. And then vaccines could have saved many more lives in other parts of the world if they'd been made available. And there were schemes from the World Health Organization to purchase vaccines and share them with many other countries, and they just couldn't get the doses. So that's a missed opportunity, and I hope something that will be resolved later in time for the next pandemic. In terms of communication, I agree with you that communication was better in some other parts of the world, and I don't know how that can be resolved in Hong Kong in the future. I'm at a bit of a loss to think about how things could have been done better, but yeah, I don't know. What do you think, Judith?
I'd be happy to take that.
Christine,
No,
yeah.
Yes.
Actually, I'll be happy to take that. I think the Prime Minister of Singapore did a brilliant job, because we all watched him and how clear he was. And in fact, his message could be absorbed by many other people who listened to him. I think in Hong Kong, definitely our leaders could communicate better. And you could say that that's a skill that could be learned. I would also say that in different parts of the world, you can find those who were clearer. I mean, there were consistency in some places and enormous inconsistency in some places. There's also the difference between, let's say, SARS and COVID is the rise of social media. So there was just a lot more out there. And we addressed in our book one of the huge concerns of the WHO quite early on, and they call that the infodemic, that there was deliberately wrong information, right? There was misinformation that may be not deliberate, but it was not the right information. So I think the level of how government and institutions like the WHO need to deal with that huge amount of information and disagreements out there about some key issues was, again, confusing and confounding. I would say that between Singapore and Hong Kong, Singapore has quite a controlled press. But here in Hong Kong, actually, there was a lot more diversity. So I think if you're looking at the total picture of different jurisdictions, it has something to do with the leaders' ability to communicate. And also in our book, we addressed in the opening chapter, the introduction, about US research that has come up with, for example, President Trump was actually, they identified as a major source of misinformation. So what I'm saying is, when we look at the whole picture, how leaders and you could say influencers and people who are in authority, how they communicated, what they chose to communicate, had something to also do with the culture of specific places as to the circulation of debate and information about how they might act. And yes, there's definitely stuff that was rather confusing, and the WHO tried to address that. That was why they put out their website, to try to inform people as and when information came about.
With that, we're out of time for the official program. We encourage you to stay around and talk to our guests. And sounds like when Professor Law feels better, we should invite you back for part 2 of this. And please, the book is available for both signing and purchase. And so thank you. With that, let's give a long applause to our speakers and panelists. Thank you. And with that, we would like to ask for official picture. And I do have some special gifts and saving for our Professor Law next time when you show up in person.
Thank you.
Stand up.
So
Do we stand up?
yes, would you stand up for the official picture?
Oh,
So,
right.
And